what I would like to do is start off by just thanking our sponsors, because without our sponsors, this program would not be possible. And so I'm going to start off first by thanking MS Views and News for bringing this MS Mental Wellness Chat. What a great time during COVID when we really needed to connect, and this has been a really great format. So thank you to MS Views and News. And we must thank the sponsors for this program too. So thank you to EMD Serono, Novartis, Bristol-Myers Squibb, Janssen, which is a pharmaceutical company of Johnson & Johnson, and Biogen. We are very thankful for your sponsorship and for tonight's program. So we're going to go ahead and get started. So tonight we're going to talk a little bit about breaking the stigma, and we're going to focus on counseling for MS and how it can be helpful. And before we dive into all the topics, I'd like to talk a little bit or introduce myself. Now, some of you may know me if you've been attending these MS mental wellness chats, but some of you might not. So we're going to move on to the next slide, and I'm going to explain a little bit about myself, introduce myself to the people that don't know me. So I like to share my story in numbers because I think it's the most effective. But 17 years ago, my husband and I were married. And 16 years ago, I was diagnosed with multiple sclerosis. Now, I won't go into the nuances of my diagnosis, but I live with MS and it's not perfect. Actually, today I have quite a bit of fatigue. And so, so you may notice that a little bit in tonight's webcast. But I have MS and I've been living with MS for 16 years. And then 15 is the number of years that I've been a social worker, specifically helping people live with chronic disease. And 14 is the number of years that my son turned. So I had my son after my MS diagnosis. But these two pictures, I think, really explain a little bit about my work and my counseling work with people living with multiple sclerosis. So the picture on the left, MS does not get today. That is really important for me to help people find a way where MS is a part of their life, it's integrated in their life, and it's not going anywhere, like my MS is not going anywhere, but it doesn't rob all of my experiences or my joy or my ability to do things, even if I have to modify it. So, so that's a really important aspect of my counseling with people. And then the other picture right there, your story matters and you should tell it. And so I hope that that picture encourages you and also shows you a little bit about me. I really like for people to share and to connect. So this is a reminder that this is being video recorded. So the program, when we're done, within a week or two, will be posted on the MS Views and News YouTube channel. And so if I say a resource or share something, I don't want you to feel stressed that you didn't write something down, you didn't get all the information, because it's going to be available to you. The other thing I like to share is if you're new to this series, we like to use the question box. And so I want us to get comfortable with using the question box, and you're going to see how I read what people write. This is not interactive in the sense that you can see what everyone else writes, but I make sure that I can give a voice to you guys. So we're going to move to the next slide, and we're going to test out our question box. So if you can open up your question box and let me know, type in your name, where you are from. Actually, your name will come up automatically. So just type where you're from, and have you seen a counselor before since your MS diagnosis? Or have you ever seen a counselor before, just in general? So we've got, let's see. Oh, a lot of people, you guys are typing so fast. Great. So we have James from California says yes. Anne from LA says yes. Helen says no. Karen says yes. Tammy from Tennessee says yes. Shannon from Greater Vancouver says yes. Carol says yes. Boylan says yes. Joyce from Illinois says yes. Maddie from Greensboro, where I'm from, said yes. Sonia from South Carolina said yes. Celia from Canada says she has not. Michelle from Arizona, yes. Patty from Oregon, no. Let's see, Carolina from Boston, and she's seen a counselor. And Deborah has said many counselors. Pam says yes. And Daniel says no. And so, and Kanita says yes. And Micah says yes too. So you can see that, so from right there, we have a really good mix. We have some people that have seen counselors and some people that have not seen counselors. And so I'm gonna call on some of the people that have seen counselors for some of their experiences. But I hope more than anything that we'll leave tonight's program and say, have a better sense of what counseling for MS can do, and how you can utilize it, and how it might be helpful for you, and how we can break the stigma about it. So we're going to move on to our next slide. Tonight's chat is going to be about a couple of things, and I have a really big surprise in tonight's chat, and I'll explain it in a minute. The first one is we're going to talk a little bit about counseling for MS and what does it look like, because it's the same as traditional counseling, but it's also a little bit different. We're going to talk about when it's needed, and you know, if you're asking yourself, could I benefit from counseling? We're going to talk about that. We're going to talk about what we can expect in a counseling session. What does a counseling session look like? And this is the great surprise, is I have someone that I have worked with, someone that used to attend my professionally led MS support group, that is going to come in on the WebEx later and talk with us a little bit about his experience. And then we're going to talk about some different therapy approaches that are used in MS counseling. So it is a lot of information tonight. But we're going to start with breaking the stigma of counseling. We're going to stay on this slide for a little bit. So if you're near if you want to write in the chat box, you can say yes or no. Do you know people in your life that that really have a stigma against mental health, that they don't believe that you should get treatment, or they've discouraged, you know, counseling or therapy or medications, etc.? There are lots of yeses here, like lots of yeses, and there's a no too. My hope is that one day we won't know people that that have a stigma against mental health treatment, but right now we do. You know, we do find that we have a lot of people that have a stigma against it, and that does impact people's comfort level with getting the help that they need. And so why is there stigma? You know, one, I think it's due to lack of knowledge about mental health. And we're starting to get better about talking about mental health more, being a little bit more vulnerable, connecting, being more open about it. But there is still stigma there. Also, there's stigma with people that sometimes that have mental health issues and display avoidance behaviors. They don't want it to be treated, so they create a stigma for themselves. And then also a fear and anxiety about a label that would be placed on you. And that's one that I hear quite a bit. And then there's just general stigma about mental illness in general. So last month on the MS Mental Wellness Chat, I talked a lot about mood and mood challenges, mood changes in MS. And what we know is that with MS, there is a greater likelihood, not guaranteed, but a greater likelihood that you may experience depression or anxiety or a mood challenges. And so I want us together tonight to see if we can chip away a little bit at the stigma and normalize this. And so I will normalize it for myself. I have anxiety, and that's something I deal with my own MS. But I have went to a counselor early on in my journey as well, and I'll share a little bit about that. But I think that's important that we learn that we can kind of share our experiences. So we're going to move to the next slide and talk just a little bit about counseling and what the role of counseling looks like for people living with MS. So counseling, in general, it's typically done by a trained mental health provider. And this can be a licensed clinical social worker like me. It could be done by a psychiatrist. A psychiatrist is a person who prescribes medications too. It could be done by a licensed clinical social worker, which I just said that, or a counselor, or a marriage and family therapist, or a psychologist. So there are master's level and doctorate level clinicians, but usually it is done by one of these professionals. And these professionals are all qualified, if they're licensed, to diagnose and to treat people with mental health conditions. So, and many mental health specialists are trained. We do talk therapy, just traditional counseling, behavioral interventions. We address mental health issues, interpersonal difficulties, and other psychological and social concerns. And counseling can be done individually. It can be done as couples or a family or even in a group setting. So the role of counseling in MS is really important. And I think counseling has I think, per my opinion, a very important piece of the healthcare team for somebody living with MS. And the reason why is that there's so many different aspects of MS. There's one, increased risk of mental health challenges. And then also how MS affects people very differently. Later on, we're going to talk about when you were newly diagnosed. When I talk with Matt, we're going to focus on that a little bit. But during the early stages of MS, counseling can be helpful, but then also as MS progresses. And even for some people, just having counseling, living with a chronic disease can be helpful too. You don't have to wait till a disease is progressive. You don't have to have it just in the beginning. A continuum of having a safe place to process, to talk, and to help with any challenges you have is actually a really great idea. Counseling really is an effective tool, and it can help you to deal with the emotions that come really at any stage of living with MS. Early on, in the early stages, you may just feel very overwhelmed by the diagnosis of MS. And as the disease progresses, you may feel like, that it's more challenging and you need a safe place to kind of talk. You might need to talk in both scenarios about losses, either actual losses or perceived losses. And since MS can pair often with grief and anxiety, depression, and confusion, there can be anger. Counseling can be a very good resource, a safe place for you to process these feelings. Now, there's different types of counseling that I'm going to share. And one of the counseling is short-term solution-focused counseling. And this kind of counseling I do offer. And this counseling is more goal-oriented. So I might have someone that is newly diagnosed. And in every session, we kind of work on different topics of concern for them. So it might be psychoeducation, it might be just talking and communicating to people. It might be, we might focus in one session on disclosing their MS. And so in those sessions, we usually have a couple of maybe 5 to 6 sessions on the schedule, and we try to very intently work on the short-term goals and the short-term things that they wanted to work on. And then there's long-term counseling, and I see that with MS too. And in that counseling, I might see someone every 3 weeks, ongoing every 2 weeks. It's pretty rare that I see someone weekly unless they're more in a state of crisis. But MS takes so many different shapes, and the needs are so varied that counseling can be adapted to exactly what your needs are. So we're going to move on to the next slide. Okay. I'm going to ask you guys something though first. When did you decide that you needed counseling? How did you know that you needed to see a counselor? If you can go to the question box and just type in, for the people that saw a counselor, how did you know that it was time to see a counselor? Okay, I'm waiting. Okay, James is a really good, James said, when I couldn't find joy. Yeah, that's a really good sign, that a very significant sign that counseling could be helpful. Deborah asked a little bit about cognitive behavioral therapy. I'm going to talk about that, so don't worry. I'm going to talk a little bit about some specific strategies. Maddie said, when I spoke at a support group, I spoke to his support group, and talking to his group helped him to realize that he needed counseling. Tina says, I was overwhelmed and anxious and depressed and needed someone to talk to, I believe. I couldn't get all of that. Crystal says her diagnosis and her stress was really bad. Joyce, depression from various areas, a death of a son. And then Wanda said, I need it, but I haven't been to any sessions. So I hope that today that we'll be able to help encourage you to find and utilize this resource. Micah said, after my divorce, I was angry all the time. I knew something had to change in me. And then Bridget said, when I was overwhelmed with my family with MS, overwhelming my family with MS. And Tina asked, how can you find a good counselor in your area that takes your insurance, knows about MS, and that you like? Okay, we're gonna, I'm gonna answer that question real quick, and then we're gonna move on. So you can find, and this is a question that gets asked a lot. I think actually at every mental wellness chat, I've answered this question, and I will always continue to answer this question. If you want a counselor and you want to find someone who knows a little bit about MS or specializes in MS, one thing that you can do is that you can look at the National MS Society, and they do have a list of a professional resource center, and you might be able to find someone in your area. It's not super common to have a lot of therapists that specialize in MS. And so the second best thing, and we have people from all over the United States on this call that probably live in rural areas, that live in bigger cities, you know, so there's a different variety of situations here. But you can look to see someone who specializes in chronic disease. And you do see that a lot more than someone who specifically specializes in MS. And what I can tell you is that while I specialize in MS, and that seems, you know, that's where my biggest knowledge base is, I can treat somebody very well and easily with fibromyalgia because there's a lot of things that are very similar, or someone with rheumatoid arthritis, or someone with Crohn's disease. So I think it's more the chronic disease piece of it that is the beginning of finding a good therapist. You could look, ask your neurologist. That's a good place to start as well. I also believe it's good to ask your support group. And so see what resources are there. In terms of finding someone that you like, finding a counselor is kind of like dating, I think, sort of, in the sense that, you know, it's really hard to sometimes find a good match, but sometimes it's easy too. But you don't know unless you try. I usually say that, you know, give it 2 to 3 sessions, because the very first session, just you might have felt off, or you might have been anxious. And so give it 2 to 3 sessions to see if you're a good fit or not. So we're going to talk a little bit about when is counseling needed, and would I benefit from it. So I love all the input that people had on why they, what was going on in their lives, what kind of told them that they needed to see a therapist. And those are really good examples. Other things that I would add to that is a mental health diagnosis. The first person who mentioned they couldn't find joy. You know, if you're experiencing symptoms of depression or anxiety, if you're having irritability, if you're finding it hard to do the things in your life that you normally enjoyed, that's a pretty good sign. Also, another sign is when you just need someone to talk to. Maybe you don't have a very big support system and you want someone that is not related to you, that is non-biased, and someone that is going to be able to just give you a non-biased opinion. That's a good sign. And I have people that come to counseling for that reason too. Or if you just need help coping or communicating, or if you just realize that there's some aspects of your life that have just been particularly challenging. So what you can expect, the next slide is what to expect. What does the counseling session look like? I'll tell you from my practice perspective, and I've been a client before as well as a therapist. As a therapist, a client can expect that a session will last 45 to 60 minutes, and usually it's 45 minutes. But in that 45 minutes, they have a really safe space. They have a place that they can bring their concerns. They have a place that they are not going to be judged. And they have a place that whatever they talk and disclose is not going to leave my office. The only time that I ever would break confidentiality, or a therapist would be in the case that we were afraid that our client was at risk for either harming themselves or harming somebody else. So it's a confidential, safe space. You also, right now, could expect that a therapy session would look like this, except I would see you and you would see me. So right now during COVID, this is what therapy has looked like for me, and it's been very comfortable. I never thought that video would be a really good substitute for in-person, but it has definitely become that. And I have built some really good therapeutic relationships with people that I haven't seen in person, and I've been able to continue really good therapeutic relationships with people that I did see in person. We just carried over on video. So right now during COVID, you may see that there's more video options than in person. So I'm going to talk a little bit more specifically about what a counseling session really entails, but we're going to move on to the assessment and treatment plan. So the reason why I'm sharing this is for the people that never went to therapy before and have not seen a counselor, and they're feeling like they might want to, but they don't know what that first visit's going to be like. And I like to share this because I think it's a really good place to start. The very first session with your counselor usually is to talk just a little bit about what's going on. Any details of your life. This is where I like to ask people, I ask a lot of questions about their demographics, where they live, where did they grow up, who's their support system, you know, are they working or are they on disability? But I start to dig at how MS impacts them. So for somebody with MS, I kind of really hone in on that. I'm also going to ask questions like how their mood has been. And I will administer a couple of tools to kind of see if there's more depression or anxiety symptoms. I'm also in this the assessment process, I'm going to ask them what matters the most to them. And what does a good quality of life look like to them? Not what they're living right now, but what does it look like to them? For example, I say a good quality of life for me is when I'm able to make dinner for my family after a busy day at work, because then I know my energy is a little bit better managed. And I don't do that all the time, but for me, that's my example. But I would ask people about quality of life. What does that mean to you? What matters the most to you? What do you what do you like to do? What are, what is your social life like? Are you supported with your MS? So I'll really dig at MS during the assessment process. And then I'm going to learn a little bit about the background as well. And then usually in this session, this is a longer session, it usually lasts about 60 minutes, we will end with what is it that the patient needs right now, or what do they want to work on in therapy? Because I could come up with ideas and strategies and suggestions, and sometimes I do, but I want you to be the leader in your therapy because it's yours. And so I want to make sure that I am working with you in a way and in the area that you want to focus on. So usually by that first session, you have an idea, one, probably if you like the therapist, because you'll have an idea because you've been talking to them for an hour. And if you don't know, it's okay. You'll probably go back to them 2 or 3 times just to see. But then you'll also have an idea, okay, well, this is kind of what my plan is going to be. So you start to kind of develop your treatment plan, which can in itself be satisfying. And to know the assessment and treatment plan, while it's not the beginning of the counseling in terms of the session, you're not in a regular standard counseling session, it is the beginning step to getting help. So I think it's a very brave step of the process. So we're going to move on to the next slide. And we are going to do something fun here. I'm going to ask Matt, my friend Matt, to put on his camera and unmute. Are you unmuted?
Yes, I am.
Okay. So my friends on this call, this is my friend Matt, and so let me tell you a little bit about Matt. Matt, I call him my friend. It's because we're peers now, but we go back a little bit of a ways, maybe 11 years.
Mm-hmm.
Okay, yeah, and I met Matt when I was a social worker working at the National MS Society, and I was leading a professionally led, newly diagnosed support group. And this group was something I was super passionate about. I'm going to do a spoiler alert that Matt later took the group on for me, and it became a peer-led support group instead of professionally led. And now he leads an incredible group. He rebranded it, and but we started working our work together and our connection probably at one of his most anxious times with MS. So I'm going to ask you to share with the group. I'm going to ask you some specific questions that I think would be good to know. Is how did you start attending that newly diagnosed support group? How did you find it? What inside was going on that made you go?
Well, the truth is that I didn't want to go. The truth is that I had a lot of MS-like symptoms, and my wife say, she looked it up. She said, there's this support group in Kernersville, North Carolina. Why don't you just go? And finally, I broke down and said, okay, I will go. And so that's how I got started going to the group. It wasn't through my own means. I needed a little push to get there.
Okay. Do you remember what it was like the very first time you went?
I was very anxious. Absolutely. Mm-hmm. I didn't know anybody. I had no idea what to expect. And I didn't even know if I had MS. I just didn't believe I had MS at that point. Yeah. A doctor had diagnosed me, but I said, I'm going to some other people. I'm not sure. Just because you're an expert doesn't mean I have MS.
Mm-hmm. Now, I remember, and I asked Matt's permission if I could share this, when Matt first came to the group, he came with a big notebook. It was big, and he probably has a notebook still. And there you go, absolutely. And he had lots of questions, and every once in a while it would just be he and I, because it was a very new group, or me, him, and one other person when we first got started. And Matt just had question after question after question. And I believe that the group ended up being kind of a safe place to kind of really start learning about MS.
Yep. Absolutely. That is where I started really kind of learning and understanding what it meant to have MS. And I learned from that group that just because you had MS didn't mean that your whole world was going to end. Mm-hmm. So that was a key learning in that first year from that group, was that, there is a light at the end of the tunnel, and it's not a train.
Yes, and that's what you would get. Like, you got that experience from a support group, but you also could get that experience from counseling too. That same. Now, what would you say was like one of the biggest things that you gained from attending the group when you did, as an attendee, not as a facilitator?
Well, I kind of learned one thing was that I wasn't alone. Mm-hmm. That other people had issues too, and that you don't need to feel alone, and you can connect with other people. I learned a lot about how the disease, a little bit about how the disease affected people, and then how people overcame it. And I saw different people overcoming different things, which was inspiring to me. So that was helpful in the group setting also.
Now, what would you tell that younger version of Matt 11 years ago that kind of was a little bit ambivalent about going to get support? And what would you tell him now if you could tell him something?
Well, I suppose that I would try to explain that, you got to see things in different perspectives. So by going to a group like that, you're going to get a lot of different perspectives, and it's going to help you. So try to just go and, all right, that Matt, you weren't going to convince him to go. He was stubborn, but maybe you could convince him to just get some other people's perspectives. So I think that's what I would tell someone.
Okay. And it was worth the risk, and I'm glad that you took it back then. Yep. So hang tight real quick. My computer, my GoToMeeting went away for a second. So what I'm going to do is I'm going to create a little transition here. And Matt, I want you to stay on. So now I'm going to talk a little bit like, let's experience a counseling session. And so I'm going to ask you a couple questions, just like I would ask a client that I normally see. I'm going to pretend I see you actually every now and again. But I'm going to pretend that you're a client of mine, and because I know you, and I really do know you. But I'm going to ask you a couple questions that I ask in every therapy session, just so our group can get an idea kind of like how a MS therapy session might be structured. So one of the things I'd say is how have your moods been since I've seen you last? So I'll let you answer that.
Well, I've been anxious, quite frankly. I've been very concerned about, how I'm able to operate and work having MS. I've been on disability. I'm not sure that I can go back to work. So I'm very anxious about all that.
My goodness. So it sounds like you've been having a lot of anxiety.
I have. I'm very worried about this. Now I've gone back this session, assume it's 11 years ago.
Yeah. Okay. And so other things I would ask, and you don't need to answer these because I'm going to just run through them, but like I'm going to ask about your MS symptoms. How have your MS symptoms been? How about sleep? Are you sleeping well? Exercise. Are you able to exercise, even if it's modified? How have your stressors been? And also in a traditional session, like if I was working with Matt, I would be following up on education. So if we were, in which you and I focused a lot on education back then.
Yep.
And so you would have questions, and then I would give you resources. I don't know if you remember that. I would email you resources and get you resources, and then it was sort of your job to review them.
Yep.
And then I would give you space to talk. And so in a counseling session, that's kind of what happens in my sessions anyways, but it's a safe place to kind of talk about whatever's going on. Now I'm going to ask you a question, Matt, and then I'll have you take your video off because we'll continue on. But
Okay.
with the one thing I would say, you know, from now until next time I see you, what is one goal that you have for yourself, or what is one thing you would like to do?
Wow. You know, I would probably say, you know, I'm going to do a little bit more exercising. I'm going to try to get out, and I'm going to try to get outside and do a little bit more than I have been doing.
Okay. And I might ask, you know, like, so that sounds like a really good plan. Do you have anything specifically that you would like to do?
I remember, yeah, my goal would have been to be able to mow the lawn.
I remember that. Yeah, I remember that. So, so as a counselor, I would really work with Matt and try to help him get as specific as we could to having a plan. And then I would ask him how confident he was that he would be able to do that. And with so Matt, we are done with you right now. So thank you so much, everybody. This is really brave and great of Matt for doing that tonight. But so in the therapy session, what you would see is that I would do kind of like a traditional kind of just, how are you doing? How is MS affecting you? How is your sleep? What are your stressors? You know, what is life going on? And then I kind of stop and I give you space to kind of talk, because some of my patients just need to get things off of their chest. And then we look at, are there educational needs? Are there resource needs? And then we look at our goals. We look at our treatment plan. And then we sometimes have homework. More than often than not, we have homework. And then we close our session. So in my therapy sessions, usually are pretty standardized in that aspect. But if I have a patient that needs to come and just talk, I start where the patient is at, and that can be very, very helpful. So we're going to move on to the next slide. I'm going to just talk a little bit about family and couples counseling. And I'm going to stop and I'm going to ask our attendees, can you, if any of you have done family or couples counseling, especially specifically related to MS, please put that in the question box. And I will get us started. So when I was newly diagnosed, I was a newlywed, and I had a lot of anxiety about the idea that I was newly married, a lot of guilt actually too, that here my husband married me and now I have MS, and I felt really bad. For me and for him. And so I had him go to my therapist with me a couple of times. And that was really helpful early on. So we could kind of just process it together, because it was something that we both were going to live with. Since then, we haven't done couples counseling, but we do a lot of relationship work. You know, being a therapist, I have a lot of tools and resources. So we do keep the communication pretty high and a focus on having a healthy relationship. So I don't have anybody on here yet that has had family or couples counseling. But what I would like to say about that is that MS impacts everybody in the family, right? And so it can cause, multiple, or different responses for different people. And it sometimes MS can, place pressure on you, your spouse, your loved one, and couples counseling is a really great resource to help figure out, okay, how can we do this together? I believe in marriages is that sometimes it's not just MS. There can be other challenges and other things that that happen, and couples counseling can be a really great way to help with communication, to help with finding strategies to work together in the midst of a challenge. And so I, definitely recommend counseling. Now I've got a comment on here. So Deborah said yes, but the other person wasn't interested. And so, yeah, with couples counseling, you need to have really active participants, right? Because if you have one person who's motivated and willing to work together, and the other person that doesn't want to participate, that doesn't make it very therapeutic. And so, I'm sorry, Deborah, because that's really frustrating. And couples counseling, one of the things that a couples counselor can do is also give it space to kind of help explore those big differences in people, where or in a relationship where one person's very motivated and wants to focus on it, and then the other person does not. I recommend family and or couples counseling if you feel like you need to do it. I know early on I felt like I just needed my spouse to go with me to process this loss that I was feeling, and it didn't hurt anything, and it helped a little bit, but it really didn't hurt anything to do that. So we're going to talk a little bit now about different therapy approaches that are used in counseling for MS. And I actually, no, let's go back to that chat box question real quick. Okay. What is something that you have learned from counseling? So we're going to talk about therapy approaches in a second, but I want you to go to the chat box and put in, what is something that you have learned from counseling if you've went to counseling before? And as people are typing, I will get us started. In my own counseling, as a person living with MS, I learned cognitive behavioral therapy, and that was a game changer with my anxiety. So let's see. We have a couple people still responding about couples therapy, which is great. Michael and he and his wife started couples therapy, and that helped to cope with her diagnosis. Okay, counseling, so going back to what counseling has helped, counseling has helped Boylan not feel alone. For Tammy, that it's okay to be with her feelings, that is great. And it has helped with acceptance. Tina, it's how to express anger in constructive ways. And then Deborah says, don't expect therapy to solve problems. I will kind of support that a little bit, Deborah. Therapy will not solve your problems, because you are going to have to navigate your problems, right? And therapy doesn't take away MS. Therapy doesn't take away problems, but therapy finds ways and strategies to help you cope with. So I will definitely say that. And so we're going to move on now to different therapy approaches that are used for counseling with MS. I'm going to start with talking about, we're going to stay on the slide. I'm going to talk a little bit about cognitive behavioral therapy. And so cognitive behavioral therapy is used to really help identify kind of faulty ways of thinking and learn patterns of unhelpful behaviors. And so it's the point of cognitive behavioral therapy is to really change our thinking and our responses to things, so that way we can behave a little bit differently. And there are a lot of therapists and even chronic disease counselors that are specialized in cognitive behavioral therapy. I definitely do and use cognitive behavioral therapy a lot in my sessions, but I'm not a trained cognitive behavioral therapist in that sense. But you can find someone that is either trained in it or someone like me that just has a lot of resources and works with it a lot, because cognitive behavioral therapy works really well with MS. And the goal is really to help to change kind of maladaptive behavior or thinking patterns. So to stop, if you're automatically assuming or thinking negatively about something, it's to help kind of reframe it or help to look at it a little bit differently. And I think one of the hallmarks is to look at cognitive distortions that you may have in your thinking patterns. And this with MS is really important, because if we can identify some of the cognitive distortions that you may have, like, for example, all or nothing thinking. So if I can remove all or nothing thinking, where things are just only black or white, or say that my all or nothing thinking is if I can't enjoy watching my son's baseball game without getting tired, then I just can't do it. That's kind of all or nothing. It's just I'm not going to be able to do it. Whereas you can learn to adapt that thinking to, I can actually go outside and watch my son's baseball game if I am able to bring modifications, or go to the car and take a break, and I'm still the mom that that I want to be, and supportive in the way that I want to be supportive. It just has to look different. The other therapy that or therapy technique or approach that I like to use is acceptance and commitment therapy. And this is probably one of my favorite therapy approaches. And this is where you learn to live with, to stop, avoiding or denying or struggling with inner emotions. And allow yourself to accept some of the difficult emotions. And I even think with MS, accept some of the difficult feelings and symptoms that you experience. And with that, allowing yourself to live your value, to do the things that you want to do. So you commit to making necessary changes based on your values, and so you change behaviors regardless of the impact of these negative feelings. And so an example would be related to, I'm trying to think just off the top of my head, anxiety. So say that that I'm living with anxiety, and because of my anxiety, it limits my ability to go out. I'm really coming up with a poor example here, but to go to a social event. But deep down, I really want to be able to go to a social event, but because of my anxiety, I just don't go. Because it feels uncomfortable. Well, with acceptance and commitment therapy, we find strategies that can help you allow the anxiety to be there and allow you to cope with it, but also allow you to go to the event, because the event is really what you really wanted to do. And so you allow the anxiety to sit with you while you still do things that are important to you as well. It's a very interesting therapy approach, and it's one of my favorites, because it's allowing the reality of MS or the reality of your symptoms to be there, and also allowing you to live out some of your values, or move forward with some of the goals that you want to move or to look forward to. So other therapy approaches, and I'm not going to go in depth with these, are stress management and resilience building. I spend a lot of time with patients on stress management techniques, because we know that stress doesn't go hand in hand with MS at all. And resilience building is something I like to focus on, because I think that while MS can feel like it takes away a lot, there are ways that we can build. And if we can build from our strengths and then also find ways to really maximize our ability to be as resilient as possible with MS, then I think that we can live a little bit more well with it. Also, boundary setting. I find that I do a lot of boundary setting with people with MS, and not for the people with MS, but for people to be able to learn how to set boundaries with others. And there's multiple different reasons why I utilize boundary setting, but it really is something that comes up a lot with my MS patients. Another one is grief and loss. I would say on all aspects and ranges of the disease, there is work on grief and loss, because there is a lot of grief and loss that's embedded within living with MS. And then psychoeducation. This part is very important, especially for my newly diagnosed people. Knowing where to go to get information on multiple sclerosis. MS Views the News is a great organization, and definitely one I recommend, because they have such great programs. But helping my patients to be connected to education, either by the education I provide or the resources that I give them, that is a fundamental part of my counseling work. And then mindfulness and relaxation, helping people to find ways to calm anxiety, to calm stress, to help cope with depression. And then probably the last thing I really focus on with people with MS seems to be communication skills, communicating with their loved ones, communicating with their friends, finding ways to talk with people about their symptoms, finding ways to set boundaries or to say no. And so those are primarily a good handful of the examples of the type of approaches that I work in with people living with MS. Now we're going to move on to our next slide. Okay, we're going to pause and respond here, which means when some of you have signed up for the program, you might have submitted a question. And I have a lot of questions here and a couple pages. And I go through and I find a couple questions that fit really well with the program. And so, so here's the very first one I'm going to read. Any chance on dealing with anger issues? So I want you to remember that iceberg. When we think about the MS iceberg, the tip of the iceberg is the symptoms that people see, and at the bottom of the iceberg is the symptoms that people don't see. When you think about the iceberg, I like to think about anger in this way. We often see anger, and it's the tip of the iceberg. That's what people see. They might see irritability or anger. That might be what you feel is anger, irritability, frustration, etc. But when you dive down lower into that iceberg, you will find that often it looks like anger, but it might be sadness. It might be feelings of loneliness. It might be frustration. It might be grief and loss. Often anger is what people see, but it's actually channeled by another feeling or emotion. If you are dealing with a lot of anger, I'm going to encourage to see a counselor, to find someone to talk to kind of help dig that out, so you can kind of see what are the core feelings that are making you feel angry. The other resource that I'm just going to mention, because I think it's worth it, and so I've talked about icebergs, but now I'm going to talk about a volcano. So if you think about a volcano, you think about the center of the volcano is where all the lava and the pressure builds up, right? And we have, volcanoes, and they don't always erupt, but they do sometimes when pressure builds up too much. So I want you to think about a volcano and think about if you were looking at one, that like a drawing of one, and the center would be where the lava is, thinking about like vents. So there probably is some sort of vent that helps to kind of take the pressure off of the volcano. So what I like to think of with anger is like, what things can you do? What are your vents? What are things to help you to feel a little bit less angry, less irritable, calming down, etc. And for some people, it might be crafting. For some people, it might be talking to someone on the phone. It might be taking a walk. It may be cooking a new recipe. I have no idea what your vents are, but I encourage you to explore them, because if you can identify what things help you to feel more calm, then you can help be in control of that anger a little bit more. But a counselor could help you do that and could help you identify the iceberg of your anger and some of the core emotions that you might be feeling. And then I'm going to answer one more. So counseling tips for openly communicating MS issues effectively to your spouse. So I would recommend a couple of things. There are a lot of resources on MS and relationships. They're from all the MS organizations, including MS Views and News. So I would do a deep dive and look into some of these resources, because you have licensed, trained professionals that are telling you and giving you tips. But some hallmarks that I like to say is creating a safe space to talk. Creating a circle of trust, that that you share your symptoms, that your spouse understands that they're your symptoms and they might not be able to see them, and then at the same time that you trust that your partner's not going to worry about you unnecessarily if you're communicating your symptoms. Another thing is consider couples counseling. It's not a bad idea if you guys are having a lot of difficulty connecting and you're struggling with that. Or this is another idea, is find another couple that where someone has MS and go to dinner with them. Sometimes it can be very helpful and very valuable to just talk to other couples and kind of see how does that person handle explaining their symptoms. And then it's helpful for your partner to be able to kind of see, oh, that person deals with that too. So there's a couple of different things, but I think educating yourself, attending programs, trying things, looking into counseling, and interacting with other people. Now, I'm also going to plug real quick is that next month we're going to do a program for caregivers. And even if your partner is not necessarily a caregiver in that sense, that might be a really great program for them to attend. And I'm going to encourage you to share that. So we're going to move on to the next slide. Okay, we're at our takeaways, and I know we're getting close. Yeah, we are like right at time. So our takeaways right here are let's break the stigma about counseling for MS. If anything I said tonight resonated with you and you really could benefit from counseling, I am going to urge you to try to do it, to make that connection, because I think you will find that it benefits you more than it doesn't. People with MS can benefit from counseling, especially considering that MS often has comorbidities of depression, anxiety, and other mood disorders. But also life is a little bit challenging, I think, in general, but I think it can be extra challenging sometimes when chronic disease is present. To remember that you're not alone and your MS shouldn't be done alone. A counselor can be a part of your healthcare and your emotional support team. And even if you get a counselor, it doesn't mean that you'll see them forever if you don't want to. You can even see them for intermittent times, when you're first diagnosed, and maybe when things are getting tough, and then you take a break and then you go back. It doesn't mean that they have to stay on the whole time. Remembering that there's many benefits to attending counseling, and that counseling can be a very effective tool to help you deal with the emotions at every stage of the disease, really from the very beginning to the later stages and all the things in between. We'll move on. So our next mental wellness chat, if you are on this chat, I would still like for you to be on this chat. This is, we're going to be addressing the emotional needs of the MS caregiver, but this is really good for the caregiver, but this is good for the MS patient to hear too. And this is going to be on October 20th at 7 p.m. And we're going to talk about what is self-care, how to choose self-care first. Trust me, this is something that many people deal with. They struggle with how to integrate taking care of themselves. They don't have enough time in their day, etc. Practicing setting boundaries and asking for help. Addressing burnout and finding ways to kind of deal with stress and stress that maybe the care partner has. Creating calm in your environment, and then building your emotional support team, because not only does the person with MS need that, the care partner needs that, the spouse needs that, etc. We'll move on to our next slide here. So don't hang up yet, guys. So I just wanted to say thank you to all of our sponsors for tonight's program and for supporting the MS Mental Wellness Chat Series. Also, thank you to MS Views and News. Without this organization, this program would not be possible. Immediately following the program, there's going to be a survey that comes up. And I want you to please stay on. You guys have been providing a lot of really awesome feedback, and this feedback is getting generated into new program ideas and topics, etc. So we need to hear from you, and we want to hear from you. And so hang tight. We have one more slide. And I always like to say this is not goodbye. It is see you later. I hope to see you next month on the MS Mental Wellness Chat. Please remember to fill out your survey, and I wish you a lovely, lovely, lovely evening, and I'll see you again soon. All right, bye.